Chapter 9 Medical and Environmental Causes of Behavior. Tell me where it hurts. Operant variables such as reinforcement, extinction, punishment, and stimulus control are not the only factors that affect a dog's behavior. To understand the complete picture of how dogs learn, we must also consider the environmental and medical causes of behavior. Environmental causes of behavior are those causes related to a dog's surroundings. Behavior problems can be caused by scheduling or activities, the people or animals in the dog's life, the presence of problem stimuli in the environment, such as garbage can with easy access, or a lack of supervision. A bored border collie. We received a call from a woman who was in desperate need of help with her border collie. She told us that the dog was hyperactive. She wanted to try a behavior modification program, and if that didn't work, she planned on talking to her veterinarian about medicating the dog. The owner worked all day. While she was at work, the dog stayed in a crate. When she came home, she put the dog in the backyard for 15 minutes. Then she brought him in the house while she prepared dinner. Exhausted after a day of work, she sat down to watch television after dinner, and she expected the dog to sit by her side and be a perfect companion. What she didn't realize is that border collies have been bred to herd. That means they are designed physically and genetically to be on the move all day long, working their bodies and their minds. This was a dog that needed some exercise, mental and physical stimulation, and a chance to release some of the energy that hundreds of years of selective breeding have produced. The fact that this woman with her lifestyle ended up with this dog is an all too common tragedy. What seemed to the owner like a behavior problem was in fact caused by an inappropriate environment for the dog. The treatment was prescribed for the dog involved spending time with him, having a daily play session and exercise period, and providing him with some basic training. When the owner decided she didn't have the energy or time to meet the dog's need, he was placed in a home with an owner who understood what kind of life a border collie needs. This was one story with a reasonably happy ending for the dog. Scheduling. Have you got a minute? Dogs can develop behavior problems related to their schedule of activities or to the lack of exercise or time spent with their owner. Dogs have no training and no contact with people can become lethargic from a lack of stimulation. When daily quality time is scheduled, these dogs are less likely to engage in attention-seeking behaviors. Dogs are social creatures and they need time and attention to thrive. Scheduling can also create problems with house soiling. Frequent accidents for which there are no medical causes can often be corrected by more time outside or more frequent walks. People as operant factors. The people in the dog's environment are really part of the operant factors related to behavior. People reinforce and punish behaviors, sometimes intentionally and sometimes not so intentionally. Children who are permitted to pull the dog's ears and tails will have an effect on the overall behavior of the dog. Loving, responsible owners who give their dogs quality time will most often have a dog that is a model citizen. Products of the environment. Some behavior problems can easily be fixed by modifying something in the home or yard. Dogs that dig up the exotic plants can be taught to dig in a specified doggy digging pit. Dogs that bolt or run away need training and possibly more exercise, but until the training is reliable, environmental solutions may help. Fences might need to be made higher or stronger, or children might have to learn some new rules, such as don't open the front door when the dog is in the room. Time to clean up. We often think of child-proofing our homes, but forget to dog-proof them as well. Dogs are smart, clever, and curious, and they follow the principles of behaviorism. They will try to maximize their reinforcers, stake bones in the trash can and when no one is looking. Might as well have one. Dog food bag is right there on the floor and everyone went to work. I'll help myself. At home, the presence and location of stimuli can be related to behavior problems. Garbage that is accessible will be strewn all over the kitchen floor and then carefully sorted into what is edible and what is not. Some dogs will urinate on a carpet or piece of furniture that smells like urine. An environmental solution to this problem is to clean the carpet or furniture to remove the urine scent. Problem stimuli in the environment that might cause excessive barking include dogs barking in the yard next door. An environmental solution might be talking to the neighbor about their constantly yapping dog. In every case, training is essential to teach the dog to respond to commands that will guide it to acceptable activities when problem stimuli are present. Sometimes environmental solutions to a behavior problem seem too obvious that trainers worry about insulating the intelligence of dog owners when they describe them. But the sad fact is that many people will complain about their dog getting into the trash without ever thinking about putting a tight-fitting lid on the trash can. There is no getting around the need for basic training when dealing with any canine problem. You don't need a behavior plan, you need a shovel. One owner called us to ask for help with one of her golden retrievers. This dog was eating the feces of her two other dogs when they were in the backyard. The technical term for eating feces is coprophagy. The behavior is thought to have several possible causes. Because some dogs that do this have a medical condition, the first step is addressing the problem is always a complete veterinary assessment. Medical causes can include problems with the pancreas, parasites, intestinal disorders, and nutritional deficiencies related to the malabsorption of food. Sometimes dogs eat the feces of other dogs when they are overfed. If the digestive system is overloaded, a large portion of the food's nutrients are passed in the stool. The dog eats the stool to get nutrients. Other causes for coprophagy are environmental. They include boredom and the dog simply wanting to remove the stool from the area. Some dogs that have house soiling accidents will eat the stools, and bitches with puppies will sometimes consume the stools of their puppies until they are able to leave the whelping box or puppy room. The owner of the golden retriever took the dig in for a complete medical and nutritional workup. The dog had no health problems and was nutritionally sound. When we asked her about the quantity of feces the dog was ingesting, she described a situation that immediately made it clear she never cleaned her yard. The solution to the dog's problem was simple enough. It involved a shovel and a hose and an owner who needed to work harder to prevent the problem. Remember, if it's not there, the dog can't eat it. Training was also recommended to teach the dog to respond to the command leave it for walks in the park where other owners may not have been cleaning up after their dogs. Other animals in the environment. Other dogs in the household can cause behavior problems. When there is more than one dog in the family, mealtimes may result in dog fights if the dogs are fed closely together. A behavioral solution such as punishing the fighting is one way to solve this problem. Another way uses an environmental solution. The dogs can be fed in different areas. There are more ways other animals can affect behavior. When there are not enough toys or bones and more than one dog likes possessions, watch out. The presence of bitches in season can have a big impact on the behavior of males. Environmental solutions such as close supervision, providing enough toys and separation as management techniques can be effective when other dogs are contributing to problem behaviors. Lack of supervision. When you're away, the dog will play. Sometimes dogs get in trouble when they are not closely supervised. Property destruction, car chasing, and aggression towards strangers can be managed simply by supervising the dog. No dog should ever be permitted to run loose even if it lives in the country. This is to protect other people, other animals, and the dog's life. Fences, leashes, crates, and responsible owners are some of the environmental solutions that can be used to prevent instances of destructiveness going after the letter carrier or chasing cars. Medical causes of behavior. It is unethical to treat any behavior problem with a behavioral solution if there is an underlying medical issue. Medical problems such as ear infections or a decayed tooth can cause the dog to become aggressive when touched. Dogs that have hearing problems may seem to be non-compliant when in fact they do not follow the instructions simply because they can't hear the commands. Hip dysplasia, arthritis, and other problems associated with aging can make the dog slower to sit, resist changes in positions, or feel reluctant to play. Internal illnesses can result in lethargy. A Cocker Spaniel with an ear infection. We received a late-night call from a woman with a Cocker Spaniel. She wanted us to design a behavior program for her dog. The dog was aggressive from time to time and had bitten her 4-year-old daughter more than once. As we asked her some questions about aggression, she casually mentioned that the dog had recurring ear infections. They were sometimes so bad that green pus would be seen coming from the dog's ears. When the dog's ears were infected, it would be snappy with her daughter. One of the bites occurred when the child jumped into a chair with the dog and landed on an infected ear. The woman patiently listened as we told her the most ethical and fair thing to do was to get the medical problem treated immediately. Then she explained she'd already spent more than $1,000 on veterinary bills with no success, and her husband had forbidden her to spend another dime on medical care for the dog. This is the kind of case that makes our hearts ache for a dog that is clearly suffering. We explained that we could not give her a behavioral program because the problem was medical, not behavioral. We then offered her some options. They include having someone else talk to her husband, getting a second opinion, or a new medical treatment plan from another veterinarian. Contacting knowledgeable Cocker Spaniel breeders who might be able to give her some tips about the dog's ear problems, or attempting to find someone who would donate the dog's medical expenses. She was also informed that aggression is a serious problem, and if there were any learned components to the behavior, she was dealing with a dangerous situation. Phone advice for aggression is not ethical or adequate, and she was referred to an animal behaviorist who could observe the dog at home. We also mentioned a group of rescues, Cocker Spaniels, in danger of losing their homes. The last word on medical and environmental factors. Environmental and medical factors can have a major impact on a dog's behavior. To have a complete understanding of how dogs learn, you must look at the whole dog. This includes examining its environment and its health. For many medical and environmental causes of problem behaviors, prevention is the best cure. Sometimes just a small change in the environment is all it takes. If a dog has a behavior problem that could be related to any medical condition, the first step in addressing the problem must be a complete veterinary assessment. Environmental causes of behavioral problems. Environmental category. Scheduling. Possible behavioral results. Dog needs individual time with owner. Without it, may engage in excessive attention seeking or other behaviors. Lacking of stimulation and interaction can result in lethargy. Dog needs adequate exercise. Without it, may appear hyperactive or depressed. How soiling accidents can be related to scheduling. Physical structure of home/yard. Digging, running away/bolting, and jumping fence. Presence of problem stimuli. Garbage, eating garbage, feces in the yard, cropophagia, feeding close to other dogs, dog fight, urine smell on carpet, house soiling. Other animals. Not enough toys, dog fight, bitches in season, males go crazy. Lack of supervision, car chasing, destruction of property, chasing other people, chasing other animals. Medical causes of behavior problems. Ear infection. Possible behavioral result. Aggression, resist touch. Problems with teeth. Aggression, resist touch. Deafness, hearing problems. Non-compliance does not follow instruction. Hip dysplasia/arthritis. Slower sits, not as eager to move, resist change in position such as drop on recall, refuses to jump, avoids stairs, reluctant to play. Vision problems such as cataracts, Collie eye anomaly, progressive retinal atrophy, or can't see due to hair in eyes or wrinkles, as in Charpie. No response to visual stimuli such as hand signals, jerk away or aggression with people, approach quickly, balks at hands coming overhead for petting, problem seeing in dim light. Medication side effects. Varied, can cause increase or decrease in activity, overall behavior change. Hair and skin problems such as fleas, allergies, and dermatitis. Constant scratching and chewing. Pain, non-compliance aggression. Systemic illnesses, lethargy. Allergies, dogs can be allergic to fleas, foods, cigarette smoke, fragrances, grass, and carpet fibers. Scratching, chewing for contact allergies. Food allergies can cause an increase or decrease in activity. Tapeworms, pushy to get food or suddenly raiding garbage. Prostate problems, sexual mounting, bladder accidents. Intestinal parasites, bowel accidents. Central nervous system problems, disoriented, confused. Nutritional deficiencies, lethargy, excessive begging, stealing food, raiding garbage, eating feces.